Right now, our coronavirus coverage continues, and to get back to normal somehow, doctors want to know more about the virus, specifically the antibodies to fight it. Channel 3's Kara Sunland had the chance to speak with Dr. Pavlos Papasavas, the principal investigator in a study at Hartford HealthCare.
We're launching a study for our healthcare workers at Hartford HealthCare. This is a study that involves a blood draw to detect antibodies, and more specifically, IgG antibodies against the coronavirus that has caused this pandemic. We're very interested in learning how many of our employees have developed antibodies against this virus and stratify based on their job type, where they work, how have been exposed to the virus. And this will be a very informative study for the healthcare system.
Yeah, and you said that there was similar studies in New York where a lot of people thought they had the coronavirus, they got an antibody test, and as many as 60% didn't have any antibodies. What does that mean?
This means that the prevalence of the disease in our community is not as high as we think it is. It is higher as we thought based on the testing, but it's not as high as 30 or 40 or 50%. So the prevalence of the disease in the community varies anywhere from 2% to 20% based on the geography, but it's not anywhere close to 60 or 70% that would provide what is called a herd immunity and more protection from the virus.
Right,
so,
the herd immunity is what we all want to get, I guess, right? So what do we need to have that in our final moment with you?
I think it would take more time, and at this point we need to continue social distancing and following all the measures because we're not quite there yet.
Don't have the herd immunity yet. Lastly, when will you complete this study, and what will you do with the results?
So this study involves a single blood draw for the majority of the employees, but a smaller group of 5,000 employees will have 2 blood draws, and some of the positives and negatives will have several blood draws up to 6 months. So we're very interested in learning how many of the employees who have antibodies develop disease, hopefully none of them, because this will mean that they have immunity, how many of them continue to have the antibodies present at 6 months, and how many of the employees who did not have antibodies developed antibodies during this period of time.
Dr. Papasavas, thank you so much, and we look forward to finding out what you learned from your study.
You're very welcome. Thank you for having me.